Skin has a turnover of about 28 days. Sometimes, however, it can take a little bit longer. So for us to help it, we have to kind of understand the concept of exfoliation. Exfoliation is quite important because not only does it remove the dead debris of the skin, but at the same time it also renews it and allows it to kind of become more on the fresher side. By allowing to do this, it helps in the removal of fine lines and at the same time of disruption of pigmentation. Now, how do we exfoliate? There are many ways in which we can do the exfoliation. And the first ones are going to be through the use of alpha hydroxy acids. Now, alpha hydroxy acids include a number of things, but the most important ones will include glycolic acid. Glycolic acid works on top of the skin by being absorbed and then disrupts the actual connections of the cell. And what happens then is that the cell tends to fall off. By doing so, it allows the renewal for new cells to be actually produced and at the same time removal of the dead debris and also the pigmentation. Glycolic acid is great if you have pretty much on the drier type of skin or normal skin. But how about if you have oily skin? That's where mandelic acid tends to work. Mandelic acid is slightly larger in terms of size, and it works on patients who have oily skin. Because it works on oilier skin, it helps for the removal of acne, post-inflammatory hyperpigmentation that's usually caused by acne, and at the same time helps create a matte effect onto the skin itself. That's how mandelic acid tends to work. Now, there's going to be a new form that come out, or the next generation of these hydroxy acids, what are known as the polyhydroxy acids. Polyhydroxy acids are a little bit different. I would consider them the second generation, or what we call the cousins of the alpha hydroxy acids. Polyhydroxy acids such as gluconolactone, lactobionic acid, and maltobionic acid, the way that they tend to work is that they provide gentle exfoliation, but not only do they do that, they also provide a little bit of hydration, because they act as a humectant. That's how they tend to work. So you end up removal of the dead skin, renewal of the skin, creating a much more matte effect in a sense that also tends to remove the debris and also the pigmentation, and at the same time tends to hydrate the skin. So it's fantastic for those patients who have pretty much sensitive skin. And when you apply it, you can basically apply it anywhere between 3 to 4 times a week. The last ingredient I wanted to talk to you about is neoglucosamine. The neoglucosamine is a pigment disruptor through the inhibition of tyrosinase. Now, if you inhibit that enzyme, what ends up happening is that you decrease the pigmentation that tends to happen on the skin. Not only that, neoglucosamine is also a building block of hyaluronic acid. What it tends to do is that it also tends to cause skin renewal and at the same time causes for a much more rejuvenated, brighter look of your skin. So no matter your skin type, exfoliation is very, very crucial and very important. However, you have to understand that these ingredients play a very important role on the type of skin that you have. So better see a dermatologist, let them figure out exactly the type of products that will work for you, and then start working on exfoliating your skin.